Yeah. The patient is a 67-year-old who suffered a right cerebrovascular accident resulting in left hemiplegia or weakness paralysis of the left side a week ago. Her left side is almost completely paralyzed. She is now medically stable and has been transferred to the rehab unit. She has some swelling in her left hand. You read in her medical chart that the patient is hard of hearing and has a history of hypertension and asthma. She complains of shortness of breath with any exercise. You find the patient in bed supine. So my PPE would be gloves. That's all that I would have. And at this point, I would come in, I would wash my hands, put on my gloves, read your chart, and I would introduce myself and say, "Hi, I'm Nikki Sam, I'm a student physical therapist. I'm here to help you move around a little bit and try to make you feel a little bit better today. Does that sound okay?" And then I'm going to take your blood pressure because you have hypertension and your respiratory rate for asthma. But I'm not going to tell you that. I'm going to say, "Is it okay if I take your blood pressure now?" Okay. We want to do this on the patient's left arm whenever possible, right? Do it. Blood pressure. I'm just going to take your heart rate now. Is that okay? All right. I'm secretly taking your respiration rate for 60 seconds. Okay, finish with that. So, so the blood pressure was for hypertension and the respiration rate was for asthma. That's why I did that. Then I have to do a diagonal passive range of motion with the left upper extremity. They said we could do either one. So left upper extremity, patient's left. So I'm going to help you move your arm around a little bit, and I'm going to teach you how to do this so that you can do it even when I'm not here. Is that okay? Okay, so let me think about this. So,
and this is D1 or D2?
You're just going to be relaxed. I'm just going to think through the motion really quickly. So let me just show you the motion. You don't have to do anything at all, okay? So the first thing I'm going to do, man's a pizza man.
So this is D2?
So you can just relax. I'm going to do all the work now. But I want you to know how to do this for yourself. Okay, what do you think of that? Pretty good? That's pretty good. So now if they say to me, how would you do another one, then I would start back here.
Hip flexors, remember, it's active assisted, so you're guiding.
It's going to be thumb pointing to the back.
You can control how
Yep, you would have your face rolled over.
Just do it.
Alright, so basically what we're going to do is I'm going to have you raise the legs straight, just like this.
Supporting both sides of the wrist and the upper arm. Very good.
As high as you can.
Okay.
I want you to give as much height as you can for yourself. I'm going to help you get through the rest of the motion of your face.
Hold frame. Active assisted range of motion for trunk rotation, lumbar flexion, and rotation. Okay. And I'm assuming everything's going to be for your left side. So I'm just going to move you around a little bit now. I'm going to put my hands back behind your shoulder. Is that okay? Okay. And can you scoot a little bit towards me? Thank you. So you can just relax this hand across your body. In fact, you can just cross and fold over. That's perfectly fine. And I'm going to reach back behind your shoulder and I'm going to put my hand on your hip, okay? Just relax. I'm going to do all of the work. Yeah, I think this is active assisted. So that's the motion that I wanted you to do. Let me just double check this.
This is the thoracic rotation?
It's active assisted. So now I've shown you what the motion is. I want you to try and roll over
Oh, that's
your
right.
top body as much as you can towards me, and I'll help you at the end, okay?
She
Let's do that again. Go ahead and roll towards me. Very good. How does that feel?
She can look at the right arm.
So we'll do that 10 times. Then the next thing will be to do the lumbar flexion and rotation. So you can just keep your arms right where they are. And so I'll show you the next motion too. If you can bring your knees up for me and just put your feet flat on the table, bring them up as much as you can towards your bottom. And there's two ways we can do this. We can either wrap our hands around here and use the table to stabilize, or you can actually go underneath the patient's knees. Either one, whatever is most comfortable for you. Just make sure your motion's coming from the hips. So I'm going to choose to go around her knees. And so let me show you the motion first, and then I'm going to have you do as much as you can for the second time. So this first time, I'm just going to bring your knees up to your chest. Oh my gosh, they're flexible. Okay, so now I want you to try to do as much of that as you can. I will try and help you at the end, okay?
And this is lumbar flexion.
Very good. That's lumbar flexion. We're going to do one more motion today, and that is for me to rotate your knees away Okay, so let me show you the motion, and then I will have you do as much as you possibly can on your own. So here we're gonna put our hands around her again, but this time we're gonna put our other hand up on her shoulder, the opposite direction. So here's the motion that you wanna do. You lean it down to as much range as you can, and you want your motion to come from your hips as a therapist too. So that's what I want to do. Yeah, did that feel like I was getting to the end of your range?
Well, no, I felt like I was gonna fall.
Okay, so I'm right here in your way though, so you won't fall. Okay. Okay, so let's scoot your knees up again. And this time go ahead and bend as much as you possibly can on your own. And then I will help you. Does that feel good? Okay, so we'll do that, 10 times, and then I think we're finished. Thanks for working with me today.
Thank you.
Okay.